and creating a life of well-being, wisdom, and wonder. Like Commissioner Hamburg and myself, she is also the proud parent of a Yale undergraduate. Two. Okay, great. So with that, could you welcome them with a long Okay, well, I know you're all very jealous, but I get the first question. So what I'd like to ask you about is the U.S. invests about $135 billion a year in medical research and development. And this has we lead the world in cutting-edge technologies and innovations. Much of the investment has been in biomedical research, such as nanotechnology, the new waves of biologics, the immunotherapies coming along. And despite all this innovation, the U.S. lags behind our peer countries in most measures of health. We have lower life expectancy, higher rates of infant mortality, more obesity, more diabetes, more heart disease, more chronic lung disease. The list really goes on and on. Here's my question. Let's look at $135 billion. Is it a good investment? Are we spending it the right way? Peggy was supposed to go.
I'm looking at her.
All right.
I'm waiting for wisdom.
All right.
All right. Well, I'll go first. And I think you have to break it down into a couple of components. Of course, it's a hugely complex and important issue. I mean, first, are we harnessing the opportunities in science adequately in terms of the delivery of real-world products for people and products that matter? And I think we are not doing as effective a job as possible there. And it's a complex ecosystem to move a discovery in science into a product. But I think we really need to have a concerted national strategy that recognizes all of the components and really aligns economic policies with the kinds of investments in research that we're making. Regulatory policies and pathways make a huge difference, and then reimbursement policies. They all have to align to have a healthy, well-functioning system. But the science at the moment is so exciting, and the understanding of the underlying mechanisms of disease are really giving us new opportunities to develop technologies that truly move the dial and will really result in cures, effective prevention strategies, and really meaningful treatments. And a lot of what we've invested in, has really provided only marginal benefit. So we're seeing true breakthroughs now based on advances in science. We need to continue to foster that, but make sure that we have the systems aligned to really deliver. The second thing is we have to recognize that innovation as just straight innovation isn't necessarily what we're looking for, no matter how bright and shiny it is, no matter how, oh my gosh, kind of innovation it is. At least in healthcare, it's innovation that really produces a benefit for people. And we have to keep that in mind because there are, plenty of emerging technologies that are exciting, but they're not really improving opportunities for health. And then the third thing is making sure that we actually deliver the things we know make a difference, and we're doing surprisingly badly at that. I mean, take a very simple thing, hypertension. We know that hypertension is a major contributor to chronic disease in this country. Heart disease is still the leading cause of death, stroke, fourth leading cause of death. Hypertension is an important risk factor. We have effective and cheap treatments for hypertension, yet less than 50% of people who need treatment are getting appropriate care. So I think that's an important part of the puzzle as well.
Simon?
I would pick up where Peggy left off, which is that I think the answer to your question that I would offer is yes, but. And so let me start with the but, which is where Peggy just finished up. There's only value in generating innovative insights and new technologies if they are applied in a way that produces benefit. And to take another, you used hypertension. I just take one other example, which is avoidable diabetic leg amputations. Just one measure picked at random for some pretty basic primary care processes. And the US, together with Germany, as it happens, has you're 3 times more likely to have your leg cut off because your diabetes has not been properly managed in the United States than you are in any other industrialized country. which, given that we're spending $2.8 trillion a year, seems curious. So there's something about applying what we already know before we conclude that we're getting value from what's currently being spent. So that's the but. The yes, I think, is that, like Peggy, I also believe that there are huge and exciting opportunities on the horizon, but I think that they probably are not going to be just over the next 10 or 15 years some more silver bullets of the sort that if you look back over 20th century medicine, you look at sort of antibiotics or antipsychotics or antiretrovirals or new imaging. I mean, hopefully we will get perhaps an HIV vaccine. Maybe at some point we will get a treatment for Alzheimer's, which is already consuming 1% of world GDP. I mean, those would be blockbuster gains for humanity. But my hunch is that actually the beneficial innovation we're going to get is going to have kind of three other features to it over the next 10 or 15 years. One is that a lot of the new knowledge is going to be at the interface of biology and engineering and information sciences. The second is that we are going to have to find ways of bringing into healthcare some of the general purpose technologies which have developed in the rest of the economy. So these are not going to be health-specific innovations. A lot of the information revolution is going to spill over into healthcare, and so we need a more permeable way of harnessing some of that into the health sector. And then the third piece is that I think we will only get the payoff from these innovations if they're embedded in organized systems of care. And I can elaborate at greater length later on if needed as to what I mean by that. But I would say that probably 2 or 3 times a month I get approached by really interesting folks from Silicon Valley or clinicians or others with an idea about a thing they want to do, and they can't actually find the right organizational ecosystem to really test it because there's not the other components of care lined up to make it work. There's not the ability to recycle resources such that if you produce downstream savings, you can use it to fund the upstream care. There's not the ability to execute and scale. In other words, the right kind of ecosystem to make these new ideas work in many cases does not yet exist. So to summarize, Peggy's but I think is an important one. Yes, in principle, but let's be clear about spillover technologies. Let's be clear about interface disciplinary innovation, and let's think about the organizational ecosystems required to make these innovations produce us a payoff.
Exciting. Ben, have you seen any of these ecosystems? Are you producing them?
Well, you know one.
Right. If you've seen one, you've seen them all. No, I'm only kidding. Just kidding. I'm a very strong believer in investment in research, in the sciences and technology. But having said that, I think embedded in your question is a if-then proposition that's not necessarily true, right? So the generation of new knowledge and new ways of doing things and really new avenues of approaches is really a good thing for us, and we want to make that investment. Maybe we should even make more of that investment. But the translation into the health of the population is a much more complex issue. Because it's not about whether we can do something. It's actually how you deliver that, and where does it fit, not just in an ecosystem of care delivery, but in the ecosystem of looking at health in its entirety, right? And I know I just read your book, Elizabeth, looking at how in this country we medicalize everything, right? So we're looking at that magic bullet. Well, let's look at nanotechnology and delivering specific chemotherapy to the this various place, which is great, and I hope the FDA approves it and all that stuff. But you know what I'm saying? But that's just taking a view of a very narrow piece of what constitutes the health of the society. And it's very individual. Which, if you're somebody who suffers from cancer, you want that availability. But if you're taking a larger view of society and a larger view of the population, we have to begin to think of as Simon says, much more systems approaches to things. Peggy's absolutely right. We actually can control lots of the antecedent diseases to the things that kill us in a lot of ways, but we don't always utilize we can't configure the approaches to get there. And part of it is having information, real-time actionable information. But part of it is also understanding that once you have that information, to put the accountability on one sector, like the healthcare sector or primary care doctor or a specialist, to be able to configure that is probably unrealistic. You know, you think about, I'm a primary care internist, and the average American sees a doctor 4 times a year. I mean, it's actually been pretty stable throughout the last decade and a half. That's 15 minutes a shot. That's 1 hour a year. So if you think about all of the things we can do to try to influence someone's health, especially if you look at the non-medicalized social determinants of health, it's impossible. You know, if I'm a doctor taking care of 2,000 patients, there's just no way I can address all of these issues without help. And that's where the systems approaches have to come in. And I can talk a little bit about how we approach it at Kaiser, but we're actually getting to almost 90% control of hypertensives. And it has a lot to do with having actionable real-time information, but also distributing the load beyond the primary care doctor, and really just making it everyone's responsibility. And I actually think the technology that's going to help us, if we're just talking about health, is actually going to be technology that brings us closer together in terms of social interactions, social media, those kinds of things that not only demedicalizes, and I'm not saying that in a bad way. I don't think really putting attention on what we can do as doctors in the medical world to help people with diseases is bad. But what I am saying is that it doesn't go far enough, right? That in your book you talk a lot about, you know, the social care system and how really we're networks of communities, and the larger community actually has to participate in all of the issues around health. You know, you look at one of the biggest correlations of good health is education, right? So you think about it, you know, and we're spending $3 trillion in healthcare. By the way, somebody told me very recently that $3 trillion, if we were our own country, would be a little higher than the GDP of France and a little lower than the GDP of Germany, right? You think about all this money that we're putting into it, and yet, you know, there are all these issues around early childhood education and other social determinants that could make a bigger difference overall in the long-term view of the health of the population. That's sort of where we have to rebalance how we use technology and where we have to go.
Ariana.
So, well, I think it's fascinating, this discussion. I think it's probably the most important discussion we can be having now, because it's tied into how we live our lives and what we value. And I think one of the problems with why all this amount of money we're spending, both in the healthcare system and in research and development, has not really brought us what we wanted, is that we are emphasizing really sick care rather than health care. And if we change that, and if we take a step back and ask ourselves the question, why is there so much tension and stress? After all, in the States now, 75% of the healthcare spending is because of chronic stress-related diseases, 75%. And on top of that, businesses face about, since we're here in the School of Management, 200 to 300% additional indirect costs in absenteeism, in the health problems of their employees, et cetera, et cetera. So I really don't think this problem can ever be solved at the level of sick care and providing pills or surgery or any kind of fantastic drugs if we don't address it upstream at what's happened. You know, why are we all burning out? I mean, you know, Harvard just did a study asking business executives how burned out they were. 96% of them said they were burned out. Clearly, there is something wrong at the heart of it, and I think we may need to bring in some philosophy here and ask some of the fundamental questions that my old compatriots, the Greek philosophers, used to ask about what is a good life. And right now, we're defining a good life as money and power, and people will never have enough of that. And we're not addressing fundamental questions of what happiness what the Greeks called eudaimonia, flourishing, what that is about. And this is, to me, so related to what's happening in healthcare. And what is, you talked about hypertension, and only 50% of those suffering from hypertension are taking advantage of what is available. But let's just deal with them not getting hypertension. And there's so much available now. That is the most exciting thing right now, is all the scientific research being done that actually puts flesh and blood and data on ancient wisdom. So it's no longer just philosophizing. You can actually go to the work that Richard Davidson is doing at the University of Wisconsin. You know, they're actually putting, they're examining through MRIs the brains of Buddhist monks to see the impact of meditation on gamma waves, and have real scientific, incontrovertible data about the fact that meditation is a wonder drug. And if, you know, when we talk about the silver bullet, meditation could be the silver bullet. It doesn't matter what tradition, Christian, Buddhist, Sufi, it doesn't matter. It's having a measurable impact. So why aren't we using it more widely? And interestingly enough, you know, I'm so happy Simon is going to be heading a very significant part of an ecosystem that can make a difference, because in the UK, amazing research is being done. Mark Williams at Oxford, professor of clinical psychology, has done amazing research on the impact of the fight or flight mechanism, which is how most of us live our lives. And he has this great passage in his latest book about gazelles. And he says, if you observe gazelles or other animals in nature, you see them producing all the adrenaline that we see in human beings constantly, cortisol levels, or whatever they call it in gazelle medical literature. And they run like crazy if there is a danger, but then the minute the danger passes, they graze. And they very quickly move into that recharging recovery time. And human beings have lost that capacity. Partly because we have brains, and our brains are engaged in dealing with imaginary dangers and worries, even when we're not dealing with real ones, that permanent state of fight or flight, which is magnified by our addiction to technology, so it's so hard for us to disconnect, means that we are now at a tipping point where the current way we're living is not sustainable. And if we continue down that road, there is no amount of healthcare spending or healthcare research and development that can save us. The good news, if I can end on an optimistic note, is that more and more businesses are recognizing that. And that's one of the most interesting developments, that 35% of large and medium-sized corporations in the United States now have introduced some form of mindfulness program dealing with stress, et cetera. And I don't mean just Google and Silicon Valley. I mean Aetna. I mean, Aetna is one of the key providers here, you know, because of Mark Bertolini's, the CEO's own experience. He broke his neck. He discovered meditation, yoga, acupuncture, made the benefits available to his 34,000 employees, and then brought Duke in to analyze the impact. So again, the results again were measurable. So we are seeing these results being implemented in companies including Target and General Mills and companies that are very matter-of-fact and not as likely to innovate perhaps in these areas. So that's why I'm so optimistic, and plus all the use of wearable technology that can help us track, you know, our movement and our sleep and our food, and therefore can empower the consumer to take care of their health.
Great. Okay, I'm going to take one more. Sorry, then I'll give it to the audience. But each of you, when we were preparing, we had 2 or 3, depending, calls, and when we were preparing for this panel, each of you said something of this following form. And you said it differently, but we cannot conceptualize the changes needed in the healthcare system as a magic bullet, but rather we should see the answer as part of a complex system of care. And each of you also said that just today a little bit. And I was wondering, complexity is usually defining a system that's unpredictable, uncontrollable, and emergent, rather than planned and optimized, sort of the way we might think strategy would roll out that way. In the face of this complexity, what should we do to ensure the innovations are effectively and cost-effectively translated into practice? And if you could keep in mind that this is a management school, so each person here is thinking about research or action related to sort of managing what is ultimately a complex system. So what should we be doing to ensure the innovations are effectively and cost-effectively translated into practice? Sorry.
Do I get to go first on this one too?
Yes.
Okay.
You're thinking about your questions.
You know, it's a really important question. There's no doubt that the world is increasingly complex, and I have to say that as I hear about some of the new scientific approaches to medical products and technologies that are being developed, I just hope I won't still be commissioner when they come actually before the FDA for approval, because they raise all kinds of new issues and cut across the different traditional ways we have of doing business. And we really, in these last couple of years, have been transforming our ways of doing things in dramatic ways, whether it's creating new, more flexible regulatory pathways, developing much more innovative approaches to clinical studies and the kinds of data collection methodologies using IT and engineering in new ways, talking about the interface that Simon noted, or also responding to the challenges of globalization, which are huge for us, because most of the products we regulate no longer are exclusively made within the United States, and so we have to engage around the world in important new ways. I think it comes back to something that we've all talked about in different ways, which is really understanding the overall systems. And we have a way of doing things now that is so fragmented, whether it's the healthcare system, which some people say you shouldn't really be graced with the term system because it is so fragmented, or beyond that, the whole set of players and stakeholders that are part of delivering health care and hopefully promoting health and wellness in our society. They're so fragmented that when you try to respond to these complex challenges, one thing that is done that is positive and makes a lot of sense may well be undermined by some other part of the system that has no leverage or even insight into what's going on in the other part. So I think for a school of management and for an effective, sustainable approach to these problems that will really help to deliver better care and hopefully bring down costs and put an emphasis on prevention and health as opposed to treating problems after they occur, we really do have to step back and we have to look towards how we can achieve this much more integrated, systematic approach. It doesn't really answer your question, but begins maybe to address how we map out the challenges at least.
Simon, you got any answers?
No, but I'll make a few comments. I mean, the first is that in terms of complexity and the difficulty of kind of predicting exactly how the health sector broadly understood is going to look kind of 10 years out, 15 years out, that's clearly true. And I was just reminded actually on a plane just before Christmas reading The Economist, The World in 2014, and this was published, I think, well, it was published, November, December, something like that. And so their predictions for high growth, the highest growth economies in the world in 2014, I think in the top 3 was South Sudan. So, even within the space of 12 weeks, they were off on that. And I was put in mind of, in fact, a Condé Nast front page, probably in 2012, which is just before Gaddafi was overthrown. Now's the time to visit Libya for your holiday. So, I mean, yeah, of course, healthcare is a complex sector, but there's lots of other complexity in the world. And I think sometimes we use that as an excuse, particularly as a lot of the complexity is self-induced. So I think it is perfectly conceivable to have a more system-oriented approach to how we go about organizing our interface between the public and care delivery, including the broader factors that Aaron was talked about. And frankly, there are parts of the country that do that. So, I mean, this is not, just a sort of fictional dream. You can recognize within a large and heterogeneous country that there are places that have frankly got their act together. And as somebody who at the moment lives in Minneapolis and is always keen to come to New Haven in January for the warmer weather.
He delivered it.
That's right. The truth is that actually, if you look in the Twin Cities, I would say care is organized in a pretty rational way in the Twin Cities. If you look in Miami-Dade County, you would have to say it isn't. This is not a complexity that is God-given and undoable. And also, frankly, some of the trends that are facing the health sector are pretty predictable. I saw a presentation being given by one of the national for-profit hospital chains to Wall Street investors a little while back, and they had conveniently got a map of obesity rates across the country, and they had marked where their hospitals are relative to the highly obese states in the country, and had made the point that that obesity level is going to lead to a lot of demand for the cardiac surgery and other things that this hospital chain is willing to offer. And I was put in mind of the notion, this might be an urban myth, that the prison building companies use as their leading indicator for where to locate facilities the high school graduation dropout rate. These things, there are patterns here. We are capable of saying, if we carry on as we are, this is what we're going to get, and we can do something about it because there are parts of the country, let alone parts of the world, that already have done.
Fascinating. Don?
Yeah, I think that, I guess the key to understanding and trying to provide an answer to your question is really how do we, what do we think is complex, right, in a lot of ways. And I think that one of the things that makes us so tired and makes us so exhausted thinking about this is that, if you fundamentally have an approach to the world and look at the world as getting more and more complex, because we want to control different aspects of the world, right? Because really, in a lot of ways, that's one of the reasons why we get so exhausted, because we see the world in all of these incredibly different, diverse parts, and we segment the world in terms of, well, how are we looking at home life, community, healthcare, education, and we don't see it as a whole, right? We don't see it as, as a real organism. We talk about ecosystems all the time now, and once you start parsing the world in terms of different components, and you begin to see how we're attacking different components, and how we're doing it with so many different forms and all these problems, then you're really going to get tired, right? You're really going to get tired, and you're going to get exhausted, and you'll think that there's no way any one person can control the world. But the truth is that that's our own construct in a lot of ways, and it doesn't have a lot to do with the overwhelming reason why we all go into healthcare. I mean, I guess I'll bring it back to healthcare, and that is to actually try to make a difference in people's lives and to deliver on a promise of trying to keep people as healthy as possible. I mean, that's a very simple concept in a lot of ways, and we make it very complicated because we think about it in the biomedical world, we think about it in terms of doctors, we think about it in terms of what the research world is doing and what devices we can do. So I actually want to come back to something that Ariana is talking about, and I can't say that I'm a devotee of Buddhist meditation, but I actually think that you actually have something that's very important to grapple with, and that is that when you're faced with what seemingly is a complex world, you can get really exhausted, and you can you feel so overwhelmed and tired. And you're always going to look for an antidote, right? And the antidote is not necessarily rest, right? And actually, a poet David White, who was a poet, once said that the antidote to exhaustion is not necessarily rest. It's not necessarily rest. It's wholeheartedness. It's about how you approach the world with a freshness and a flexibility, and wanting to really understand things and put it in perspective, and drive towards the outcome that you want. I mean, we lose sight. Actually, I think in healthcare, and I probably have succumbed to this. You lose sight of why you go into healthcare in the beginning very often, because you're so totally overwhelmed. I used to run an emergency room. I mean, it was the hardest job I ever did in my entire life. I don't think I'd ever want to go back. During the peak of the crack epidemic, Peggy knows this. And it was brutal. I'm telling you, it was brutal. People coming in with AIDS and homelessness and multi-drug resistant tuberculosis and no beds in the hospitals to take care of them. And I just was so exhausted all the time. And you very easily lose sight of why you're doing this because you don't think you can control all of the other factors around you. And in some ways, it's true, you can't. But you know, the only way out of that is to take a step back, meditate maybe, do Zumba classes, whatever it is that you need to do, and take a look at what we're all trying to get done and why we're trying to do it, and collectively approach it. The other mistake that we all make is that we have to solve the problem, right? There's a wonderful CEO forum earlier on. I hope you guys went to it, but you know, they are absolutely right. It's I mean, even though you think the CEO is the brand and you have to be the face of the company, you can't do it alone. No one can do it alone. Doctors think they can do it alone, but they're not. They can't. It's all part of being part of a bigger team that takes on the collective mission and try to figure out how to get it done. And once you actually take that wholehearted approach, you know, looking at the larger picture, the longer view, and really understand that we're a community of caregivers, that means something. It's a community. It's all of us trying to get to that point. It makes it a little easier. And you know, I can go into some specifics at some point if people are interested. But I really think that truly is the antidote. And I think meditation will help too. Zumba classes. I have to tell you that I promised that I'm going to go back, put on spandex, and join a Zumba class, because as the face of the organization in Southern California, I have to model this stuff.
You have to appear in spandex.
Exactly.
Do you want to add?
I think actually there is a very simple truth at the heart of this complexity. And when we get hold of it, it will be much easier to deal with all the problems. And I think that very simple truth is that we are not just our bodies, that our minds have a very significant, tangible effect on our bodies. And I think our whole medical system in very many ways has ignored that truth. So it's almost like trying to have a navigation system based on the assumption that the Earth is flat. You are going to have a lot of sunken ships. And that's what's happening here. And, you know, it's not just meditation. You know, the whole scientific evidence on sleep now is overwhelming. You know, sleep has been something that has been made almost like fun of. You know, there's this kind of macho bravado of people, you know, executives kind of competing with each other, how little sleep they each get. You know, it was like an indication of virility almost. And now, you know, there's practically no university, medical school that doesn't have a sleep division. And all that's happened in the last few years. And I actually, because I'm a big evangelist for sleep, having myself fainted from exhaustion and broken my cheekbone while I fell, I was invited to join the executive council of the Harvard School of Medicine Sleep Division. So, and as a result, I get constant information, and it's just amazing the research being done. So when we talk about meditation, it's really, think of fly fishing. It doesn't matter what you do, just do something that can bring in all the advantages of recovery and recharging. And getting back to that simple truth will make it much easier for us to deal with the complexity. It's like going back to Archimedes, who said, give me a place to stand and I can move the world. I think we've lost the place to stand. And unless we recover it, we won't really be able to solve these problems, which are getting worse and worse.
Fabulous. Okay. Oh, my. I think you were the fastest one up right here. Could you put, the mic. The whole time?
Clever.
Whole time.
The whole time.
It's stressful, but
Well, this is a good way. This is a good way to cut the question short. So, I'm Rob Cortel. I was at SOM, first class, and all that stuff, and we do work with the commissioner. It seems to me that at the heart of this is complex because it's about individual people, all of whom are complex and different. So Commissioner, you can control the quality of drugs, and you can control the quality of healthcare delivery, and you can do the same, and you can sleep through some of the stuff they send you for the sleep. But at the heart of it are people. So there's a very prominent post delivery company. They did a healthcare panel to figure out how to change their system. And they have two populations. They have people who sit in the office and do stuff, and their main health disease is heart. The people outside who are delivering the packages, their main problems are sprains and fractures and things like that. So as a company, they have to try to change behaviors and all that. But you can't. If you're a laborer, how likely is it that you're going to have the time to meditate, remember to take your medicine, stop lifting too much if you're well-educated? And think about all of us. We're all well-educated and pretty high income by and large. And we forget to take medicines, and we don't always do exercise, even though we have all the information driving us. So I just read a book called The Circle, which is about a Googleized world where we're all pushing people to do all the right things, and we use technology and the Internet of the Things to deliver healthcare in the future and all the rest. But how do you deal with the fact that it's at the core, it's people? Do these raise any issues?
Who wants to take that? You don't all have to take it.
No, I think that you raise a good point, and that's how we approach things, right? We fragment, and so that we can control different aspects. Even in medicine, right? We subspecialize. Your neurosurgeon does this, your cardiologist does this, primary care internist does this. You know, all of that is how we actually have approached this complexity, and really, it's probably important to have expertise. You need islands of expertise, but you have to put it into a whole picture. You know, and Kaiser, you know, we're an integrated healthcare delivery system, and we have ways to go too, because we're still steeped in a medical model that we're trying to move out of. Not move out of, I shouldn't say that, but to enhance in a lot of ways, because the medical model will take us just so far. And of course, there's a lot of things that we could do within the medical model to enhance coordination, communication. But the idea is that it's still us doing something to you, right? It's like you come to healthcare world sees the world in a we and they approach. And it's not about that, really. If you look at the total health of the population, it can't be, we have the expertise and we're going to tell you what to do and you have to do it. Because then you think, oh, if you're not doing it, you're not doing the right thing, when there are other factors involved that may or may not make it the highest priority for you, right? So I think one of the approaches that we're trying to get to is, and everybody talks about being patient-centered this, patient-centered that, but if you're seriously patient-centered, and that's not taking the focus from the individual, because ultimately the health of the population is a sum of everybody's individual health in a lot of ways, right? So I'm not trying to say it's a global solution where somebody up high says we're going to be healthy and then everybody's healthy. It's not. It can't be that way. But if we're going to be successful, it really is a partnership between the doctor and the patient, or the delivery system and the community and other communities and corporate world. I mean, I think that the discussion about corporate responsibility is a really important piece of this. And it's about messaging. How do you message this so that we're all really moving for the same thing? And I actually think that patients and families and friends actually have so much that they could actually provide to get people to adopt healthier lifestyles. How can you actually get people to exercise when we're in concrete bunkers, right, in an urban area? You need open spaces. You need to encourage people. And to tell you the truth, we try to get our members to exercise a lot more. We have exercise as a 4th or 5th or 10th vital sign now and I can tell you how self-reported what people say they do, whether they do those kinds of things. But if you are alone and you live in an isolated world, which so many of us do, right? We're so parceled, and you don't have somebody to walk with you or to take whatever you like to do, you're not going to do it. So I think it's about reaching out into the larger society and appreciating that we're one organism within a whole society of organisms, and we all have to work together to try to get to a different place.
I mean, one of the things that always strikes me and I've had the opportunity to work in a lot of different settings at this point, is that, we are always looking. It must be in our DNA for the magic bullet. And there really, for most of the problems in the real world, there is no one solution. The problems are multi-determined, and the solutions have to be multifaceted as well. I think the critical thing is to be able to really identify what are the goals we're trying to move towards, and what different kinds of institutions, individuals, organizations, and approaches can make a difference in what aspects of the problem, and not be overwhelmed by the complexity, but break it down into manageable pieces. I was thinking about this just a moment ago, because Ben and I did work together in New York City, and one of the great challenges that I faced when I was commissioner, and Ben had an important role to play, was dealing with the problem of a resurgence of tuberculosis, and particularly drug-resistant tuberculosis. And interestingly enough, in medical school at that other institution, Harvard,
Won't talk about it.
I had learned about it as a disease of historical interest.
Right.
I mean, I never thought I'd be taking care of TB patients, let alone managing an epidemic. But when we started to try to grapple with it, people said, forget it. It is so linked to poverty and homelessness and substance abuse and now HIV that, you are not going to be able to turn this around without fixing those other problems. And yes, it is intimately intertwined, yet as health commissioner, I wasn't going to be able to fix poverty. I wasn't even going to be able to fix substance abuse or homelessness. But we were able to both look at all the different factors that influence the problem of tuberculosis and actually work together to have a strategic plan that cut across the criminal justice systems and the transmission of TB in prisons, to look at the homeless shelters and realize that we could move from these big armory-style shelters to more apartment styles and reduce transmission. We could look at the public hospital system, but most importantly, we could look at the individuals and make sure that they were getting the treatment they needed to cure their tuberculosis and limit transmission. And we did that with a very primitive approach, which actually I learned about from work that had been done in Peru, but where you sent community workers out to make sure that people took their medicine. And for TB, it's a fairly long treatment course. And even though we didn't cure those bigger problems, we were able to have a system that recognized the problems and where patients could get lost in the system and address it. And we were able to make sure that individuals got the treatment that they needed. And we actually brought down the rate of drug-resistant tuberculosis in New York City by 86% or something like that in just a couple of years. I mean, we did so much better than we ever imagined that we could. So I think, we have to not get overwhelmed by the complexity, but break it down into manageable pieces, but also recognize that our piece can't stand alone. It has to be integrated into a larger whole.
What's right here? You, yes.
The technology straight. I think I do. So I don't know if the panelists were there this morning in the discussion, but there was an interchange between Indra Noory and somebody in the audience in his role as a parent about the role of PepsiCo vis-a-vis producing a product that had a negative impact on his kids. The reason I mention that is because I'd really like to have some input from you on whether there's a moral imperative on the part of businesses in terms of product development, in terms of producing products that are not negative, have not a negative impact on health. And even if a business is producing something that does have a negative impact, what's the imperative there to ameliorate the consequences of the use of that product on the part of the public? And I have to tell you honestly, I'm a former CEO of a food manufacturing company, and this is something that I actually thought about in terms of the product development during my time in the business, and I'd love to hear your input.
All right, fine.
Well, there is no question that there is a moral imperative. What we are seeing now is that it also is becoming a business imperative, because a lot of these questions were not going to be asked necessarily with the same amount of possibility of going viral, of many millions of people being involved because of social media in the past. So, in the past it was much easier for a company, even a tobacco company, to hide behind, glossy ads and some disclaimers in the footnotes, and get away with a lot. And now this is much harder, so the demand for transparency has increased dramatically. So a lot of companies are looking at what impact this is going to have on their bottom line. So there are business reasons for making the right decisions, but it's still incredibly hard. I mean, we have a massive food industry producing food that is dramatically and directly contributing to the obesity epidemic that leads to all these studies about where the hospital should be built. So, and we have a campaign finance system that makes it easier for politicians to turn a blind eye when all those involved in the food industry are getting special benefits even. So this is definitely incredibly complex, and that's why I think that going back to the individual, making better decisions is going to be a key factor in changing this ecosystem.
Simon, did you have something to say?
Well, just picking up on Ariana's point, I mean, I think part of the answer to this is going to be changing consumer demand. And as the parent of two youngish kids, we don't let our kids eat junk or drink rubbish, other than on exceptional occasions.
How old are they?
10 and 5.
Just wait.
Yes, just wait, right?
They'll move straight on to beer when the time is right. So there's something about, and it's not a flippant point, because some of the work that my organization's been doing with parents of severely overweight kids, looking at whether or not home-based programs over a 6 to 9 month period, actually going through the refrigerator, doing the documentation. We've just published results on this of the first study we've done in the journal Pediatrics a few months ago, showing that you can actually have an impact with this very kind of intensive engagement in home situations with parents and kids. Obviously, that's not been done at scale, and it would be good if we didn't have such an uphill battle against all of the kind of competing influences to do it. But I think that's going to be part of the answer. I mean, of course, lying behind your question is, if not that, then what? And that's when then people go to either regulatory or fiscal instruments as a way of trying to change the weather on this debate. And I think personally, the action that some school districts have taken around getting junk food and sodas out of schools is important. I think there is a responsibility on companies like Pepsi, and actually my reading is that Pepsi has probably been one of the more thoughtful companies in this space. Whether they have been commercially rewarded on the back of it, I think is a question that I wouldn't want to opine on, but I suspect that they and others are smelling the coffee.
Mm-hmm. Great. Can I just add one little thing? It's such an important question, and there certainly are companies that are taking the lead, as PepsiCo is in terms of moving towards formulations that bring down calories and reduce trans fats and other things. I think there's an important role of regulation. It won't surprise you to hear me say that, in part to help encourage movement in ways that actually improve the safety and quality of products and make it easier for corporations to stick their neck out to do the right thing. Because we can come in behind sometimes companies that are responding to health needs and help to level the playing field. Because right now, the companies that are moving towards reducing calories, moving towards lowering sodium, et cetera, often feel that they are a little bit at risk because consumers aren't automatically, moving towards these products. So I think that is an important role of regulation, as well as obviously responding in a more aggressive way to, health claims that are completely untrue, et cetera, or requiring that actually, demonstrated dangerous things come out of the food supply, like, we recently took an action to get trans fats out of the food supply. So I think, that these are really important issues, and there's a sort of a back and forth as we iterate towards better solutions. I also just did have to reflect on the fact that for the first time, the FDA is regulating an industry where, at the end of the day, we are not aligned in terms of the goals of safety, efficacy, and quality, and that's the tobacco industry. And that is creating a whole set of new issues for us. But that's a whole other topic of discussion. But it did pop into my head when you asked the question.
Right. And just very, very quickly, I'm a lifelong lover of Cheetos, so I can tell you that. But the thing is that I think it is a little unfair to say that it's all the food industry's responsibility. And I think that from the healthcare delivery world, and actually as a supplier of products for employers, there is a larger corporate responsibility as well. And we've actually been doing a lot of work around, really making sure that we do food labeling. We actually, the hardest thing, the one thing that I got the most grief from our employees was banning sugared sodas. You think that it would be, wages, benefit, whatever it is, it's banning the food that people know and love. But you have to make that stand, right? But you have to also offer alternatives. So we do a lot of work with farmers markets on our sites. We're a lot of our advertisement is around healthy eating, active living. So it's sort of a social marketing campaign as well as a Kaiser campaign. And I think that if all of the companies around the world start to do that, there will be pressure, and people will eventually change their tastes. I think, I don't eat that many Cheetos anymore, so it's okay.
Okay, right here.
Yes, I'm what they call a innovator, medical innovation. I did technology transfer. I'm CEO of a company. I have a question on 4 areas that we all face in our business, and that is the commercialization plan. The second is regulatory. The third is regulatory, commercialization, and clinical significance. And the fourth is lowering that cost. So what happens with us that have to take innovative medical devices, and our device happened to come under the Space Flight Center, so we commercialize it. We're now faced with having to deal with those issues, and how do you get through regulatory, for example? We're cloud-based, so what's regulatory looks like for that? Adapting it to a larger population, a younger population. I spent 10 days in Beijing. It's a younger population. How do you handle that? How do you handle rural? Even though we may not look at rural populations, but city and rural kind of closely relates together on how we deliver this new innovation of healthcare. Whether we're dealing with HL7, are we dealing with medical records in the cloud? How do we protect against that? What regulations are added to us now that are cyber, for example, for malpractice is an added regulation. I just want to feel what your feeling is having to work in healthcare, having worked in the healthcare industry. Where does that look for us innovators that are out there looking for that idea, co-create that idea, delivering the idea, and then one important part, and that is global adaptiveness to this new technology. Very difficult to do. You might say, I got a brand new technology, we're FDA cleared, we're ready to move it, but then you have different parts of the country says, well, I can't accept that because the way healthcare is constructed, whether it's delivering a process or surgery or that, or lowering healthcare costs by having unnecessary procedures. And I think the regulatory has talked quite a bit about how do we lower that cost? Is it lowering unnecessary procedures? And also adding to that would be preventive medicine. So us people are looking at that. That's the marketplace that we're in.
Could I translate that? So there were a million questions in that question.
Right.
But I think the one that maybe I would pull out is that here's an innovator. They've got a cool new idea they think can work, but there are a lot of barriers to actually get it translated, particularly if something is rural or the regulations are already barriers or we're just stuck in the silos we have. So how does the innovator look at what is a sticky market there and try to push it through, push a new idea through, I think.
Yes, hopefully
He said it was already FDA approved,
Yes,
so I'll.
So you're out of it.
You're off the hook. You're off the hook.
Well, we can definitely offer you the Huffington Post platform to write about it and write about the benefits. I think right now, I mean, all joking apart, there is no question that one of the ways that innovations can accelerate their rate of adoption is by using social media and using the fact that you can have thousands of people writing about the benefits and spreading the word. You have like word of mouth accelerated 1,000-fold. And therefore, you can have people who don't have the ability to advertise or to have like huge publicity and marketing departments behind them who nevertheless can break through the static.
Yeah, I don't know if I can give you any practical suggestions, but I actually think one of the problems we have for innovators is that, you know, we are a $3 trillion economy. We're actually pretty fixed in how we do things, right? We talked a little bit about medicalization and how we're sort of fixed to the model that's very time and space oriented, right? So it's hospitals or doctors' offices, procedures, and a lot of the innovation that I think is a lot of the problems with innovation is that the new tools and technology allow us to break down those temporal spatial barriers, right? So 24/7 ability to reach people in remote locations, telehealth capability, but with linkages to the highest technologically capable expert 24/7. You know, all of those things are problems in care delivery innovation. That's I think where the space, why you're having the problem in trying to introduce a great new idea, because we're so fixed in our old ways of thinking about how we need to deliver care. The care delivery system isn't open to the, and actually it's true for the payment system, because we've been having this running debate with the Medicare and Medicaid people at CMS about telehealth. Because you think about telehealth, boy, that's a technology that's not even that new, right? It's older technology, but it allows people to bring expertise right to where the need is 24/7, and yet the payment streams are not there. And I mean, if the payment's not there, you're not going to get a lot of people driving that. And so it's really about trying to get the care delivery system to embrace the change, and it's a lot about really about changing the processes of care. Much better job, and I think the key is how are you going to do the better job? I mean, all of the 4 factors you talked about, more affordability, better outcomes, et cetera, all target the end user, the patient or the member, whatever, however you want to call it. And that's probably the key to driving the dialogue and the discussion.
Good. Another in the back, right there. Yep. You. Yep.
I wanted to ask about the impact of exploding Alzheimer's rates and costs, largely because we have conquered so many diseases and made them not fatal. And I was wondering what this means for efforts to extend life, end of life, when it's often the most expensive. And I understand it's eating up a huge amount of our medical. I don't actually have one. All right. Should I start from the beginning? You go. Okay.
I'll proceed.
I'm asking about the impact of complying with of exploding Alzheimer's rates and the costs, largely due to our conquering diseases or making them less likely to be fatal, and what this means for efforts to extend life at the end when it's most expensive, in light of the fact that we have to die of something.
Simon, that's yours.
Yes, yours.
NHS person.
We do have to die of something, but we don't have to die of it just yet. And we don't have to die of it in an avoidable and painful way in many respects. So I think there's some basic science that is going on around the mechanisms that explain dementias, including Alzheimer's, and there have been a number of false dawns in that regard, and I'm sure Peggy or Ben could talk more about that. You know, there are some people who hold out the hope that progress on the beta amyloids is what's going to kind of get us to something significant. But at a less profound level, there's actually some other work that researchers have got going on looking at the sort of neurovascular components of dementia. And in some quarters, and I don't have a point of view as to whether this is right or not, there is the view that elements of dementias may now be preventable and may relate to some of the broader risk factors that we know for other chronic conditions. And so certainly in England, for example, there is now a big push on around early diagnosis of Alzheimer's with a view to putting in place the kinds of support and interventions that could make a difference to people's subsequent trajectories with that very difficult condition. So I think if we could end up with a cure for Alzheimer's, that would actually be one of the genuine transforming cost takeouts as well as huge improvements in the human condition. Because you could potentially zap, if not a whole industry, then at least a pretty large part of one called nursing homes. And let's face it, most people do not want themselves or their family members to have to spend their dying days in an institutional setting. So I think this is a huge challenge, but it's also one that perhaps over 10 or 20 years could be one of these real blockbuster gains.
Right here in the third row back, yeah.
Yeah, hi. My name's Avi Prabhakar, class of 2004, and my question for the panel is, if you were a first-year student getting ready to come back and have class in this classroom on Monday, this beautiful building, or if you were an alum like me 10 years out and you dreamed about having an impact on all of the things we've been talking about this morning, what are the areas you would look to as growth areas to try to get yourself involved so you can make a difference?
Great question.
But it sort of depends on what your interests and passions are, because there's so many different avenues.
Focus on everything we've been talking about today. Assuming that I think we would all say the discussion's been exciting and great and right on the mark. So I think it's all related to what we've been discussing this morning, probably.
Well, if you are a business leader, you have incredible opportunities to introduce in your company a lot of the practices that have measurable results, that do work, and have tangible improvements in the health of your employees, which has amazing repercussions when it comes to talent retention, when it comes to employee culture, et cetera. And we have companies that are doing that, whether it's Salesforce or the Boston Consulting Group, or if you look internationally, Volkswagen, for example, has introduced a policy where they give smartphones to employees, but the smartphones turn off at 6 p.m. and turn on again at 7 a.m. so that people can begin to have, again, a delineation between work and life, which has kind of disappeared now. And at the Huffington Post, we have 2 nap rooms, which when I instituted them 3 years ago, were met with derision. Nobody's ever going to be seen going into a nap room in the middle of the afternoon, and now they're perpetually full. And we have to start a third one. We have refrigerators full of healthy, free snacks, although the baby carrots are never eaten, I have to admit. There's Safeway did amazing things with their employees that, again, had real measurable results. I keep stressing that because it's so significant that we're not just talking about ideas or what we would like to see work. These things are working. And so I think business leaders have a huge opportunity to make a difference here. In Davos this year, there's going to be a special track on this. Again, if Davos is a weather vane of a new wisdom, new conventional wisdom emerging, I'm actually moderating a plenary session called Health is Wealth, where companies and countries are beginning to reprioritize what matters to the bottom line or to the gross national product, which in the UK now, David Cameron wants to have a new measurement, the kind of measuring the well-being of the country, and not just what it produces in terms of goods and services.
Any other reactions?
So I don't think I can offer thoughts quite as profound as Arianna's, but I would say that I do think that there's going to be a lot of very interesting development on the back of the hype around big data, and I don't think it's just hype. I think there's something real is going to happen in medicine in that interface zone, and in particular, I think we're going to see the kind of reclassification of disease etiologies on the back of it. We're going to be able to revisit some of the back catalogue of the drugs that Big Pharma has not found work for the median patient, but which might work for subpopulations. We're going to find that the cost of some observational research falls to near zero. And remember the original, I don't know whether you have a healthcare background, but I mean the original Framingham heart studies had an N of 5,209 people. Well, there's no reason why that can't now be 52 million. So we're going to see a big explosion, I think, of insights. Of course, there are risks, and it's not going to mean we're going to not need RCTs for a lot of profound questions. We are. But there's going to be a lot of action in that zone, I think. So I would suggest that's kind of one interesting place to be. And then I had a moment ago, because I think there's going to be an explosion of interesting technologies that only when they're knit together, I think, is where a lot of value is going to be created.
Right here, go ahead.
Yes, in the world of change seen in our industry is that when the hard, I'd rather do Google. And then you also see people, and they're now the sort of innovative and find these things. So we've had this tremendous surprise as mess. What do you think, besides some rosy answer of everybody will see and improvements in healthcare?
Care Act, not of course one of the big issues is expanding coverage, but I actually think embedded in the Affordable Care Act are some incentives that are the care delivery system to innovative change, right? To transform some of the fragmentation that's in the system, and whether it's imperfect at this point, and I actually think that's starting to take hold. I shouldn't say one of the things that I did this year was I chaired the American Hospital Association, and you think hospital executives are so embedded in procedure, that's their economic model, but I was surprised the Don Berwick configuration of what's our really behind that in a big way, and I actually think we'll push that a lot further. Now, how fast it goes, still prepayment models that are out there that takes away the incentives just to drive individual increases in volume. Still only about 15% are bundled or prepaid payment. But I actually think that over the next 3 years, and we can't see this as a one-year implementation. See, March 31st, when the open enrollment ends, that's not the end of the rollout of the Affordable Care Act. It's going to play out over a 3 to 5 year period. And I personally am very excited about the possibilities. We talk about integrating new innovations, new technologies. Well, for the first time, there's a little bit shaking at the foundations of how we've learned, and I think people are beginning to think about, well, can we do things differently? Big data, whatever it is that's out, has to get translated with real innovation in the balance of where we're spending our money. So I personally am very positive about what aside, and the problems with the rollout aside, computer systems will probably get beyond that. But from the care delivery side, at the fundamental levels, the positive feedback from the hospital world is that we're going to change, and we're going to change because of the right reasons. We can't really tolerate the performance that we've gotten so far.
In addition to what Ben was just saying, the opportunities to expand insurance coverage and bring more people into healthcare potentially. It does also have an emphasis on prevention, both preventive services and community prevention. And I think, over time, hopefully that will be increasingly sort of legitimatized and meaningful in terms of health and wellness.
If I could just take the prerogative of the moderator, I have one final question for you that I think is straightforward and will maybe make people feel optimistic as they go out. What is one thing you've heard in the last 6 months that makes you pretty optimistic about where our healthcare system is going? And it shouldn't be silent. And maybe it's the ACA, Ben, for you. But have you heard anything good in the last 6 months?
I'll start
Okay,
at a sort of fundamental science level, and then
Okay.
others will move out more. But I mean, I really do think that where we are in terms of advances in science and technology and the ability to really deliver on those discoveries in terms of real-world products that will make a difference for people is extraordinary. We've got big challenges like Alzheimer's in terms of, you know, really even understanding the underlying mechanism of disease and how best to study it, and then how to prevent it, treat it, or cure it. Breakthrough discoveries of late that are truly transformative. One that I'll just mention called Kalydeco, which is a drug for cystic fibrosis. It's a subset of cystic fibrosis patients, which is a life condition that's genetic. A subset of patients with a certain genetic marker were found to respond to a certain therapy. It's not all cystic fibrosis patients. Cystic fibrosis is a relatively unusual condition, yet it's the first drug that actually treats and you know, the stories are that kids are literally getting off the lung transplant list and onto the soccer field. So, you know, those kinds of things are extraordinary, and I think, you know, certainly from where I sit, you know, both helping to facilitate the opportunities to translate science into meaningful products, and then working with the broader systems to make sure that these products actually are accessible. And then, of course, the broader issues that I worked on more in past lives about, you know, broader issues of health and well-being. Coming together of all these pieces, I think we are seeing more progress, the understanding and the reach of some of this.
This starts being
Very early and equivocal data suggesting that perhaps in some places beginning to level off. Now, I don't think we can declare victory. And then the second would be spending a bit of time with who were one of the 32 pioneer accountable care organizations. And in the course of the first year of that program, they managed to take out, I think, 5.4% of Medicare fee-for-service costs, the second biggest saving in the country, as a result of not some magic elixir, but some basic blocking and tackling around coordinating care for very sick, frail seniors. So it can be done.
I'm always fairly optimistic,
Yeah, I
believe it
can
or
hear
not.
that.
Yeah, you can sort of see
your
that.
cell phone number.
But the reason I'm optimistic is allow us to do so much more. You know, when I was practicing physician, you could just do so much. You just couldn't. You were always faced with the real-time deal with your patients, how much you can control. But now with the expanse that the expanded capabilities to people, or to really interface, it's actually, I'm optimistic, is that I would never have thought that we could actually get there. You look at some of the just the publicly reported measures on, how often we actually do the preventive work on people who really are at the age where they could do that. Right. Never thought that we'd get to 90% hypertension control. 70% of people that actually it's closer to 80% now who are actually getting colon cancer screenings in the incidence of colon cancer. We do a third fewer colectomies now than we did even 5 years ago. So that's got to be positive.
Okay, Ariane.
One is the constant scientific findings that are coming out, including here Judson Brewer at the Department of Health is very significant, is the connection between compassion, volunteering, giving, and well-being. And when things like poverty and homelessness and substance abuse, if we can get more people engaged in the community in helping solve some of these problems on however small a scale, and recognize that this also has a tangible impact on their own well-being, that will be very significant. The second thing is the paradoxical way in which now technology is bits of technology, and to help us reduce stress and track our own well-being. I mean, we launched actually with the help of Judson Brewer an app, a free app called GPS for the Soul, that you can download, and it gives you a proxy for stress, your heart rate variability, and then you can personalize your own guide with the things that help you course correct. Pictures of your loved ones, music, poetry, whatever. It's under a minute, and we have again scientific evidence that shows that you can course correct very quickly. The problem is when stress and tension become cumulative. And the final thing is the way that this conversation has gone mainstream. In literally the last 6 months, people are coming out of the closet. The new closet is coming out as meditators, as recognizing a body-mind connection. That was a real closet. And now you have like the CEO of Bridgewater, the largest hedge fund, Ray Dalio, coming out and saying, I've been meditating for 35 years. I consider it a very important reason for my success. You have Mark Benioff, the CEO of Salesforce, literally 2 months ago. Never before had he talked about meditating for 25 years, et cetera, et cetera. Mark Bertolini, I already mentioned. It's like something has happened. There is a tipping point. And so making all these discussions go mainstream legitimizes them and makes it easier for people to bring them into their own life and recognize that there are very, very tangible health benefits.
Wonderful.
We do have to have better balance in our lives.
Oh.
And the tools are